so much for coming, Professor Meausoone.
Thank you.
Can you let us know a little bit about what you're doing at the new center?
Yes. So I am an assistant director in data implementation. I work at the Stanford Center for Population Health Sciences. There's different cores within PHS, as we call it, and I'm part of the data center. So my role, along with all of my peers, is to try to grow the data center. Especially, we want to create an ecosystem for researchers to engage in transdisciplinary population health research. And so what we do is we host a lot of high-value data sets, and we engage in partnerships around the world with institutions that have high-value data sets as well. And we also try to create a computing environment so that researchers can go ahead and analyze those data sets. We have on-prem servers and Google Cloud servers to allow them to see the data, access the data, figure out whether this is going to work for their research question, and then compute on the data. And then we offer a set of consulting services because we understand that these are new and exciting data that people may not have had a chance to work with before. So we offer office hours, we offer bi-monthly trainings so that people have a path, if they're interested, to find out more and engage in the research.
Mm-hmm. And what have been some of the big challenges you faced in all of that? Acquiring the data, working with researchers?
So, to date, I'm proud to say that we've been able to host about 25 terabytes of data on-prem and on Google Cloud. And I think we've managed to set up a fantastic environment because it's secure and compliant with high-risk data, but it's also easy to use and friendly for researchers. We've tried to make a bunch of tools available to them. So we know that researchers, when they engage in something new, they want to feel comfortable in the environment that's set for them, and they want to use the tools they know. So we make R, SAS, data, Python, some SQL-based tools available. But early on, when we acquired these new researchers that were really excited, as you know, when you're learning to program, you need to do a lot of iterative work and you go through trial and error. But when you're doing that on terabytes of data, it caused our servers to crash. So it was really important for us to create a playground for researchers, that this shouldn't be a limiting factor. They should go ahead and understand the data, get better at their coding, but we had to find a strategy to get there. So we have fantastic partners across campus. We work really closely with the Stanford Center Research Computing Center and with a startup called Redivis, who's developing sort of like the Google Cloud aspect of our environment. And we came up with a playground environment. So we created sample data sets, 1% samples. So when you're computing, you're not computing on terabytes of data, you're computing on something smaller. We provided sample code. We went around and asked our researchers, okay, what are the tools that will make you more comfortable in coding so that you know how to be really efficient? And then we provide, as I've mentioned before, bi-monthly trainings, consulting, office hours, so that people can come to us and ask questions. So we're at a point now where we're excited. We're developing a Slack channel so that researchers can talk to each other and answer each other's questions if they're running through the same hurdles.
And have there been any particular projects that have come out of the center so far that really excite you?
Yes, I think there's been, in the spirit of really being transdisciplinary, we've had a few projects of people really trying to overlay a lot of interesting data. There is a project currently, it's not been published yet, but that is focusing on combining climate data with information on farms and looking at the effects of heat for people living around those farms and what the health implications are in terms of picking up any events in the hospital or an office visit around heat shocks or pulmonary incidents or any type of side effects that these may have. And so it's really thinking about the data in a really original way and thinking how things can be combined for a lot of the US population, but at a very granular level.
Wow.
So it's very exciting.
Thank you so much.
Of course. Thank you.
Thanks again.
Thanks.